Hello, I'm Dr. Robert Russo, Executive Director of the Connecticut State Medical Society. Welcome to On Call with Connecticut Physicians, the Medical Society's podcast initiative. Hello, I'm Dr. Bob Russo, the Executive Director of the Connecticut State Medical Society. The Connecticut State Medical Society represents over 4,000 physicians in the state, and its mission is advocacy for the physicians and their patients. Today, we're going to talk about the health information exchanges, nicknamed the HIEs. We're pleased to have Dr. Rob Aseltine, a UConn professor who's leading our efforts in this. Welcome, Rob. So let's start a little bit about telling us what an HIE is and how it performs.
Thanks, Bob. Health information exchange is a way for us to connect the disparate data that's collected in physicians' practices and hospitals and clinics on very different electronic medical record platforms. And what the HIE does is to standardize and harmonize that information and make it available to physicians right at the point of care for them to use where it's not just data that they generated, but data generated in other locations.
So tell us a little bit about the importance to the physicians about having a well-functioning HIE.
Yeah, so the first thing, Bob, is that this is a safe and secure network for the exchange of patient data. All of these processes are HIPAA compliant, and the technologies that power those as well. And as a result, we can be very confident that the data that's being transmitted across different locations is secure. The second is that this is a very direct and streamlined connection across different types of medical facilities and across different types of medical providers. This is really a mechanism to take very complex data and to push it back to physicians in ways that they can digest very quickly and use it for the care of their patients. The third is that it really can reduce costs. The first is it prevents redundancy in testing and procedures. If something is done in a hospital-based setting, for example, a provider in an outpatient setting will know that that has occurred and not necessarily need to repeat it. In addition, the transmission of data itself is time-consuming and inefficient when that has to happen by fax or the mailing of paper records. So an HIE can really take a number of costs out of the system. And finally, really, there's some enormous public health benefits to this. We can understand our patient populations better, particularly our vulnerable patients, and provide much more appropriate and timely care to them.
So tell me a little bit about the patient benefits. Why would a patient benefit from an HIE system?
The first thing really is the ability for a physician to understand how well what they're doing with a certain type of patient, patients with diabetes, patients with hypertension, to understand how well the treatments that they're prescribing are working for their patients generally, and to make sure that those then are customized or personalized for a particular patient that has that condition. In theory, we're going to get much better feedback from the system on how well these things work, how well patients and how much they're benefiting from certain approaches to care. The second thing that's huge is the ability to get a consolidated patient record. Most people, particularly as they get older, are getting care from many different types of providers. They might be primary care providers, specialty providers, and then perhaps hospital-based care as well. All that, unfortunately, right now in our current system gets put into very separate patient portals. And so a patient that either has complex conditions or just is going through the aging process and seeing lots of different care providers, they benefit from a consolidated record. It's in one place, all their medications, procedures, history, everything's available to them.
So can you give me an example of your work about what you're doing and how an HIE might be able to help out?
Yes, as you know, I'm a researcher, and one of the most promising aspects of health information exchange, and the thing that has many of us very, very excited, is the potential to build a learning health system, where the data that's being recorded on patients is then being analyzed and made available to inform care and treatment decisions quickly, dramatically increasing the velocity with which we apply data to clinical problems. Let me give you an example from my own work. I do work in suicide risk detection. And what we have found out is that patients at risk of suicide are actually in the healthcare system. They're getting care from their physicians, they're seeing doctors, but unfortunately, the system is not recognizing their risk. What we are doing is working to take all of the data that's available in their clinical records across all their care providers and to create predictive analytics that can help us identify a patient's at risk before they become suicidal, before they consider harming themselves. It's a very promising avenue, and it's one important example of how health information exchange can provide direct benefits to patients.
So you see this benefit as basically artificial intelligence and how we'll be able to predict things rather than wait for the illness to show itself.
Yes, that's exactly what we're talking about. And the hope is that as we create these types of analytics and algorithms across a whole bunch of different disease categories and conditions, that patients will be benefiting without even needing to be in front of the clinician. In other words, all that data that's sitting there does not need to be idle. It can be used to inform the care of that patient when they're not even in the clinic.
So can you give me a little background? Where are we in Connecticut? What's the state of HIE in Connecticut?
Yes, so CTHealthLink, which is the Connecticut State Medical Society's Health Information Exchange, is doing extremely well. We established that a couple of years ago, and we now have approximately 40% of the hospital data in the state of Connecticut available to subscribers of CTHealthLink. We also were the first partner with the state's HIE initiative, which is called Connie. And as that is being built and developed later this year, we are hopeful that these systems will come together to really provide a robust solution for the state. Connie's concept is a network of networks concept. So what we're doing is very complementary and in fact, helping them to build their initiative as they move forward.
Yes, as state medical, we're all very anxious to see the rollout into the doctor's offices. So even the private physicians that may not be in a particular network would be able to feed into it. I think as a patient, I'm very excited about the fact that my medical record will be in one spot that I and any doctor that I see will be able to help. Looking forward to it. I appreciate you taking time out of your busy day today and helping us further understand what the health information exchange is going to be doing in Connecticut. Thank you again.
Thank you, Bob.
Thank you all for listening to our conversation on the Connecticut State Medical Society podcast. Please use the contact information provided here for questions and more information related to the legislative activities in the 2021 session. You can listen to other episodes of On Call with Connecticut Physicians at the Connecticut State Medical Society's website, csms.org. Be sure to engage with CSMS by following us on Facebook, Twitter, and LinkedIn. We look forward to seeing you here next time.